and thank you for joining us for the latest installment in our research webinar series, Using Research to Strengthen State and Local Disability Advocacy. We are now live.
All right, thank you so much, Kelly. My name is Stephanie Enyart, and I lead the Public Policy and Research Institute at AFB. I'm really excited that you are carving out a window of time to spend some time with us and with some of the things that we're very passionate about. AFB has an amazing research and policy advocacy team, and so much of our focus is usually in the federal footprint. But at a moment like this, where state and local advocacy is extremely important, we thought it would be very helpful to be able to bring some of the information and ideas that frame our work to you to use in your advocacy. And with that, I'm going to pass it off to Dr. Ariel Silverman, our Director of Research.
All right, thank you so much, Stephanie, and thanks everyone for being here today. I'm sure you all recognize the importance of state and local advocacy during this moment in time. So we should be on slide 2. And I'll just briefly go over a little preview of the agenda for today. I will start off by talking a little bit about the value add of research. So what does research add to our advocacy strategy and implementation? I will also talk about some of the research resources that we have on our website that you can use. And my colleague, Sarah Elizabeth Bagoon, will talk about some of our statistical resources that you can use as well. Then our public policy and research advisor, Sarah Malaire, will talk about translating research into congressional talking points, because she's done that a lot in our Public Policy and Research Institute, helping to bring our research findings directly to policymakers in a way that is persuasive for them. And then we'll hear from Denise Jess, who's the executive director of the Wisconsin Council of the Blind and Visually Impaired. And she's going to share a 3-part formula for effective advocacy and talk a little bit about the power of coalition building. We will have questions and answers at the end. We have disabled chat in order to make things more accessible for screen reader users. But if you have questions, you can put them in the Q&A. There will also be an opportunity at the end to raise your hand if you have a question. So if you're on a phone, I think I saw one or two people on phones, you can do *9 when the time comes to raise your hand and ask questions. Next slide, please. So just for fun, I've looked up the definition of research in the dictionary, and the definition you see here is a systematic investigation into and study of material and sources in order to establish facts and reach new conclusions. So let's just break down that definition a little bit. So research is systematic, it's organized, there's usually some sort of guiding question, and oftentimes a hypothesis or a testable prediction about what we might want to find. And research can include review of written sources, basically review of other people's research is itself research. But the research that we're going to focus on here is what you might call empirical research, which is collecting feedback and information or data directly from individuals. Usually the individuals who are providing data, we refer to them as participants. They used to be called subjects, but now we call them participants because that's a more empowering term. Because the participants are, ideally kind of helping to make their voices heard and help to design the output of the research. Research is broader and more conclusive than just individual stories or anecdotes because research combines the feedback of, in most cases, unless it's a case study, at least a small group of people and oftentimes a very large group of people into a synthesized whole. Next slide, please. So some of the types of research that we're going to focus on here include state or national population survey data. So there are a couple of surveys that go out every year. We'll be talking about things like the American Community Survey, the Current Population Survey, or the National Health Interview Survey. those surveys take a sample of the United States population and ask questions about their experiences or about their demographics, and then they generalize from that sample to estimate things about the entire population. And so we can use those surveys to look at the population of people with disabilities or people with specific types of disabilities and compare them to people without disabilities. Custom surveys sent to a group of people. So some of our studies involved questionnaires that we sent, usually online questionnaires that we sent to a group of people. And we will be focusing here on research that we've done with people who are blind or have low vision. But we also believe that a lot of the principles and a lot of the strategies that we'll be talking about today are absolutely applicable to other types of disability advocacy as well. And in fact, some of our research that we're working on right now that will be coming out in the next year, we're working on a cross-disability AI study. So we are definitely getting more into understanding the experiences of people with other disabilities besides blindness or people with multiple types of disabilities. But a lot of the research that we have so far that we'll be sharing is about blindness. So some of the research studies involve survey questionnaires, and those are helpful because you can send them out to a whole bunch of people and you can get numerical or quantitative data that you can use to compare groups of people or just describe trends within a population. And then interviews and focus groups can be useful to really dig deeper into a situation or an experience that people have. And you can get quotes from people that can be used directly in advocacy. You can share quotes and stories directly with policymakers. Or you can also just identify themes. So what kinds of experiences do those people have in common? And what can we learn from them? Next slide, please. So some of the conclusions that can be drawn from these types of research that will be useful in your advocacy might include prevalence of a population. So questions like, how many blind people are there in the United States? Or how many people with vision difficulty are there in the United States? How many blind and low vision children are being served under IDEA? Those types of questions, or how many older adults are there with vision loss in the United States? Those types of questions, we have estimates for them based on some of these large data sets. Prevalence of a problem. So a question might be, how many Americans have inadequate transportation, or how many Americans don't drive? How many Americans with disabilities have inadequate transportation? That's a question that you can answer by looking at survey data. You can also compare subgroups of people. So do people with and without disabilities differ in their rates of access to smartphones and computers? Spoiler alert, yes, they do. And people with vision disabilities differ from people without disabilities on those metrics. Legislators and their staff often ask us questions like, how many people are affected by this? Or, is this really a big, significant problem? So having research can give us an advantage in answering those questions over and above individual stories, which could be dismissed as kind of one-offs or unique situations. Research can help demonstrate the fact that a problem is prevalent, or at least prevalent enough that it's worthy of attention. Next slide, please. So now we're going to talk about some of AFB's research resources. Between 2019 and 2024, we conducted 10 original research studies looking at experiences of people who are blind or have low vision in the US, and in some cases Canada as well, with different types of situations, including transportation access, technology access, digital accessibility barriers, experiences during the pandemic. And in one study, and I know we have some guide dog schools here in the house, and one of our studies was specifically looking at the role of guide dogs in 22 and beyond, looking at people's experiences who use guide dogs, who used to use guide dogs, who don't use guide dogs, etc. We also did a study that we just published the results in early February about AI, artificial intelligence. And that was a study that was looking at the opinions of experts in industry, policy, and academia about how AI is likely to impact the lives of people with disabilities, including people who are blind or have low vision. So that report was recently published. And then for the older studies, we have 5 fact sheets that summarize findings across studies. So for example, we have a transportation fact sheet. And the transportation fact sheet includes facts from our Project Visitor study, which I'll talk about in a minute. It includes some information from our guide dog study, which I mentioned. It includes some information from our Journey Forward study, which looked at transportation access during the pandemic. So we took multiple studies and kind of pulled out some of the findings that we thought could be useful and put them all into a fact sheet. We also have, for other fact sheets, we have one about healthcare, we have one about employment, etc. And then we have summaries of all the research reports because we recognize that the research reports are long and you might not have the time or the bandwidth to go through and read like a 100-page research report to find the information that you need. So these summaries, which are only 2 or 3 pages long, outline the major findings from each study and the recommendations for policy changes that we want to see or changes in business practice, other actions that we want stakeholders to take are right there in these summaries. So all this information can be found at www.afb.org/research. That link is on the slide. If you go there, you will find the recent reports that we've done, including the AI report. You'll find the summaries, fact sheets, and our statistical snapshots, which you'll hear about in a little bit. Next slide, please. So here are just some examples of facts that you can use in your advocacy. So one of them is that over 40% of all respondents and more than 65% of rural respondents in our Project Visitor study said that not driving prevented them from going to the places that they wanted to get to or doing things that they wanted to do. So if you live in a rural area or you're trying to advocate with a transportation board or a task force, that might be a useful statistic to drop in somewhere. Over 65% of blind and low vision older adults in rural areas couldn't get the transportation that they needed. And we also have here, just some short kind of quotes and descriptions of where people said they would go if they had access to transportation to go anywhere that they wanted to, whenever they wanted to. Some people said they would go hiking, they would go to the beach, they would go to the mountains. These are vignettes that can be kind of sympathetic to policymakers and stakeholders to hear about. Next slide, please. Here's another fact. In AFB's Barriers to Digital Inclusion Diary study, so this is a study we did last year where we had people fill out diaries every day for 10 days in a row, and they told us how many times they had digital accessibility barriers, so trouble accessing a website, a mobile app, or a kiosk. And we found that on average, each person had 12 digital barriers per week, and each barrier took about 20 minutes to resolve. So overall, people lost 4 hours a week dealing with digital inaccessibility. That's a pretty compelling factoid that you can share if you're working on web and app legislation in your state or, looking at systems, state government systems, maybe for employees. There's also another fact there that we'll talk about on the next slide. But that's a little fact that you can pull out. And there are a few other facts in that study, as well as in the first Barriers to Digital Inclusion study. Next slide, please. We should be on slide 9. Under the ADA, employers must make employee training and onboarding accessible. But in our workplace technology study, where we surveyed blind and low vision workers in 2021, we found that 59% of them said that they had trouble accessing the onboarding paperwork in person, like the paper forms, and 48% had trouble with digital online onboarding paperwork. That percentage was even higher. I think it was actually around 74% for people who said that they worked for state and local governments. So if you're working with your state or your local government to make the employee portals accessible, that's a piece of information that you might want to share. This is a really widespread issue. And we have other facts from that study about the rates at which people reported problems accessing required training, or when their employer changed the technology that they used, they had trouble accessing training to be able to use the new technology. Next slide, please. Here's another one. During the pandemic, we did a study where we surveyed parents and teachers of blind and low vision children. And the parents or the family members reported that their blind or low vision children used an average of 4.9 digital learning tools during the pandemic. And so that's a lot, even without accessibility issues, that's a lot of tools. But out of those 4.9, 2.9 on average were inaccessible. And even though this was pandemic era data, there are still a lot of digital tools that are being used in the classroom that are not accessible. And we suspect that more will be on the way as well, in the age of AI. So this is a fact that you could share if you're working on any type of ed tech related advocacy. And then we have a toolkit at afb.org/edtech. We have a toolkit that contains some of these stats and is specifically written for school procurement officials and ed tech developers. Next slide, please. So here's some facts about employment. So according to the 2023 Current Population Survey, that's one of those really big population surveys, and we see that 42% of women working age, ages 16 to 64, and 40% of men of working age with blindness or low vision were employed, compared with 68% of women and 76% of men without disabilities. So obviously there's a big disparity. It's important to note, though, that a lot of stats that are thrown around about employment are not actually accurate. So a lot of people say 70% of blind people are unemployed, and that's not technically accurate because, first of all, the employment rate is actually more like 40 or 42%, rather than 30%. But also, technically, unemployed is a term that refers to people who are looking for work but not working. Most of the people who are counted in that 70% are actually completely out of the labor force. So that it's not that they're unemployed and looking, it's that they're actually not even looking for work. And that's a really important distinction. We do see that the unemployment rate is actually higher for blind and low vision people. It's 8% compared to 4% of non-disabled people. So there is a disparity, but the bigger disparity is around participation in the workforce. And so that's a stat that people tend to get mixed up a lot, and that's why it's really important to look for reliable sources and to understand the source of the data. So when you're talking about employment with a legislator or a policymaker, you want to say, this is from the current population survey. Different surveys have really different estimates for a variety of reasons. So it's really important to cite, the source, the year, and the data source that you're talking about. Next slide, please.
Excellent, thank you. As we talk about those data sources, the American Foundation for the Blind tracks a lot of statistics nationally about how many people are blind or have low vision. And you can find all of those statistics at www.afb.org/stats. As Ariel mentioned, there is a big variety of kind of the numbers that you can get for folks who are blind and have low vision. And the most common reason that varies is the definition in the survey, in the question tool, asks something different about vision. And so with this, I want to talk a little for a moment about the curb cut effect. In the history of disability rights, we have kind of this great moment in the early 70s when the rolling quads went and put curb cuts in around Berkeley, California. And it had been a growing advocacy movement of the importance of the right to have mobility access for folks who use wheelchairs. And it was a culminating moment, right? Everybody could understand that people who use a wheelchair need to be able to cross the street. They need a curb cut to go from sidewalk to street, back up onto the other sidewalk. Later in history, once curb cuts were widely adopted and installed at intersections all over the country, there's a very cool phenomenon now that if you go out and stand at an intersection where the curb cut exists, but maybe isn't the most obvious path of travel, so you can see who is stepping out of their way to specifically use the curb cut versus who is just able to step off the curb and cross the street that way, you can get a quick tally of how many people use curb cuts, how many people benefit from these being installed. And by far and large, the biggest users of curb cuts are moms with strollers, people with bicycles, and delivery people pushing a delivery cart. Wheelchair users still benefit from them, still absolutely need them, but there's a much broader swath of society that benefits from accessible design. And I think that's one of the important reasons why we track both very specific definitions of disability, of blindness and low vision, and also broader definitions. The narrow number, 8.7 million people report having serious difficulty seeing even when wearing their glasses. And we get that number from the American Communities Survey. That classically aligns with who you think of as being blind or having low vision. And it actually misses some of the clinical low vision population who have pretty good correction but still struggle, might not consider themselves to have serious difficulty, but might in the clinical sense qualify as blind or low vision. The 51.9 million people that the National Health Institute survey indicates respond to a question about difficulty seeing with their glasses catches more people adjacent to that. That higher number comes from including not only the people who say, I cannot see at all, and the people who say, I have serious difficulty seeing even when wearing my glasses, but that 51.9 million includes also people who say, I have some difficulty seeing when wearing my glasses. And many, 40 million of those people probably don't meet the clinical definition of a disability for their visual impairment. But if they're struggling to see with their glasses on, if sometimes their eyes are fatigued, if sometimes they squint and can't see the text on screen, if sometimes they're still having difficulty, that's a population we can assume in our advocacy are going to be some of the first people to benefit from us making a more accessible society. And so sometimes for our advocacy efforts, it's useful to know the broader number. Who is likely to benefit from this right away if we make it more accessible? And other times, depending on the language and type of advocacy you're doing, it might be important to have a more narrow definition and say, 8.7 million people really need this accessibility to have access to the content at all. So that's why we have different numbers that are tracked on our website. We also track co-occurring disabilities. So there's 2.8 million people with vision difficulty who also have trouble remembering, concentrating, or making decisions. So there's some sort of cognitive component there. You will see that we track deaf blindness in adults in terms of co-occurring disability. They report both difficulty seeing and difficulty hearing. In children, you'll see those numbers parenthetical as a call out where they receive specialized services under a deafblind program. Because always in the blindness space, it's important to include folks who are deafblind. Their narratives and insights are so important to understanding the full spectrum of the lived experience of people who are blind. We track data on age, gender, employment, and other sorts of breakdowns, as well as poverty rates, which is often really important for advocacy as it speaks to what kind of access people have to a variety of resources. In America, 22% of folks who are blind or have low vision live below the federal poverty limit, as compared to 19% of people with all disabilities in the cross-disability spectrum, or 11% of people without disabilities. So we know that economics are really significantly impacted by disability status. Next slide, please. There is another great cross-disability population statistics resource that we want to let you know about. This contains a lot of good data on poverty, on resource access broadly. This also contains state-level data, which has some benefits and some drawbacks, right? If you're looking at running a program or advocating for a policy in your state, having that state-level data can be really important. But also with census data, the state level data has a much wider margin of error, especially if you live in a particularly low population density state. When we're subdividing by disability type and state, we can get to some really small sample sizes, which can lead to a big variability in how we predict things play out in the population. But AFB collaborated on a supplement focused on blindness and low vision data with the Disability Compendium, which has just been published. So you can find that at www.disabilitycompendium.org. Next slide, please. You can also contact AFB if you find that you have an inquiry for some sort of specialized data request. We do track additional data, particularly related to any of the research studies that we do, which can be made available upon request. A great example of that is a study from a few years ago was done in collaboration with a guide dog school. And so we have more guide dog information and data than is published in that report. For example, in 2023, there were about 8,000 working guide dog teams in the USA. There were specifically 7,965. That's data we collected incidental to other work we're doing. It's not the lead storyline, but we do happen to have it. So if you are reading about one of our topics and you think, gee, I wonder if they know, feel free to reach out to us at research@afb.org with those questions. We can also pull specific census level data related to blindness and more specific questions you might have to support you in writing grants and doing advocacy work, to scope projects and decide how many people might respond to a program I put together. I need to know how big to make my program. We can look into data for you in your region. We can look up historical or archival data, all sorts of things. So please reach out at research@afb.org anytime you have additional questions. We'd love to work with you. Next slide and take it over, Sarah.
This is the VSA Big Data Project.
Oh yeah, let me talk about that real quick. So Vision Serve Alliance has this big data project where they've put out reports on working age adults and older adults who are blind or low vision. They have a nationwide report, and then they also have 18 state level reports, and there are more state reports coming out. So can somebody read I don't have the slide up. Can somebody read the URL for that?
Yes, this is Sarah.
Thanks,
you
Sarah.
can find the VSA Data Project and their reports at visionservealliance.org/big-data-insights. Great, and we can move on to the next slide. All right, this is Sarah, and I will talk a little bit about how we take all of this research and we use it in some of our congressional advocacy. AFB focuses our advocacy at the federal level. So while we produce a lot of data that's really useful at the state and local government, the way that I tend to use our research is when speaking with federal policymakers. Next slide. So how do we use research for advocacy? In our research, we discover a lot of the existing barriers, and sometimes it confirms hypotheses that we already had about what the barriers are, but sometimes it reveals new new problems that we need to focus on. So research is a great way of informing our priorities and shaping the work that we're going to do. It also helps us create a problem statement. We're looking at a lot of the barriers that people face, as well as the ways that they are dealing with those barriers, some of the things that go right. So when you have the barriers and the prevalence of the barriers, and people's descriptions of the barriers, that helps create a problem statement to understand what is the issue that we're advocating for. And when we tell stories, we do this by blending the quantitative data that we collect. So that's the statistics and percentages and averages with the qualitative data. So that is the stories that people put into their survey or interview question that gives it a little more color and flavor and really makes it a fuller picture to help us understand what people are going through. And then finally, it helps us identify solutions because we often understand what works, what makes people happy. And so that's really important information to present to a policymaker. Next slide. So I want to give you an example of how we shape a message. So one of our recent messages that we've crafted is working on accessible workforce development for artificial intelligence. And so we kind of just we have heard about issues with workforce development in conversations that we have with companies that use AI or that create AI. And we've heard about how workforce development is a priority for members of Congress. So then it was really revealing when we did our AI research study to find that several of the experts brought up issues around workforce development and education and the need for people with disabilities to be included in the development and use of AI in the workplace. So then we were able to look at multiple research studies to pull how does this specifically affect blind people. So while we're waiting on the findings of our second AI study that really is going to ask people specifically about their experiences with the AI, we still know that based on the expert consensus that there are accessibility issues with AI training and the use of AI in an education setting. We notice that is very parallel to some of the other accessibility findings that we found in our Barriers to Digital Inclusion study or our Access and Engagement study. So that gives us a lot of other research to draw from to kind of build this story and present it to policymakers. So then, putting it all together, we can go to next slide. So when I go to speak to a policymaker and say that we think that there's an issue with workforce development, we think that there needs to be accessible workforce development, AI training, and accessible STEM education for blind students so that they can become either engineers who work in the AI field or so that in any career that they choose, they're able to use AI on the job. So in our AI research, we found that the experts in our study expressed skepticism about the accessibility of AI systems that are going to be used in classrooms and whether those tools like tutors or interactive platforms, say for learning math or science, are going to be accessible. They also raised concerns that training for AI literacy is often going to be presented in an online platform with features like drag and drop functionality, and that's likely to present access barriers. We can confirm that these barriers are likely to exist because we've seen them in other spaces. In our second Access and Engagement study, we found that students were expected to use on average 4.9 ed tech tools, and only 2.7 of those were inaccessible. So about half of the tools that students were using during the pandemic to study, to learn, were accessible to them. We've also found significant accessibility barriers in the workplace. And in our workplace technology study, for example, employees could, about 25% of the employed participants reported that they could not fully access the trainings that they needed for their job. So that presents some concerns that if we're rolling out trainings for AI literacy in the workplace, that it's also going to be inaccessible. And I want to tell a couple of stories that we found in our educational research that addresses the readiness of students who are blind to enter STEM careers and to take advantage of STEM education. We had one parent who reported that they were really dismayed that when their child was given a circuits curriculum online. So this is an online science education platform. They couldn't do the work. It was inaccessible. The teacher acknowledged that it was inaccessible, but the solution was to exempt the student from that coursework. So they just weren't getting access to the education at all, instead of being provided with a more accessible science lesson. And they were afraid that that was happening kind of across the board and impacting their students' access to education. We also had several parents report that they realized that their children didn't have access to the same to computers at the same level as their sighted siblings. So, maybe their sighted blind or sighted brother or sister was using the computer all the time. And then when the pandemic happened and everybody was expected to use a laptop, they had never been trained in how to use a screen reader or how to use screen magnification. And it was really eye-opening for the parent about the opportunities that their child was going to have in the future if their sighted children were getting better access to computers in a social setting and an educational setting. So what we can take from that is that there's significant proven disparities in access to STEM education, computer skills, and workforce development and training. So we really want to emphasize the importance of AI training and workforce development accessibility. So I hope that's a helpful example of how we might tell that story by blending multiple research studies. And I will turn it over to Denise Jess, who's going to talk a little bit more about really that state and local perspective and give you maybe a little bit more in-depth description of how to build your message.
Wonderful. Thank you, Sarah, so much. We can go to the next slide. So I'd love to share with you a three-part formula or kind of equation for effective advocacy. So I'm the executive director with the Wisconsin Council of the Blind and Visually Impaired, and our mission is to promote the dignity and empowerment of people who are blind and visually impaired throughout the state. And we do that through public policy advocacy, general systems advocacy, education, and teaching the skills of blindness or vision rehab skills. And we can go to the next slide. Our values that guide our work, our inclusion, integrity, and respect. And the council has always done policy advocacy at the state level and often at the local level with legislators and with state agencies. So we can move forward. So when we think about what makes an impactful advocacy moment, and that might be the opportunity to be speaking at a public hearing. And often when we speak at public hearings, we have anywhere from 2 to 5 minutes. 5 minutes is a luxury. 2 to 3 is more typical. Or maybe we're sitting across the desk from a legislator or their staff, and we might have 15 minutes to 30 minutes. Again, 30 minutes is a luxury. Or we're in a video call or writing to that legislator. We want to have a strong, thought-provoking, and clear message, and really ties together all the things that the folks from AFB have been discussing. And I'm so incredibly grateful for AFB's work along the research lines and about thinking about application, because that research and data is critical. For the longest time in my advocacy work, I have been chomping at the bit, waiting for more data and research to be at my fingertips to strengthen the conversations that I'm having with policymakers. So frequently, we could go in and tell incredibly compelling stories. I think as people who are blind, low vision, and our allies in the disability field in general, we are powerful, powerful storytellers because our stories come from lived experience. They come from the pain of that. They come from the problem solving of that, the resilience of that, and our stories are moving. I could tell a very moving story to a policymaker who would then say, thanks, that's really interesting, but what's the data? And when I didn't have it, it was it was a painful moment because I wondered, and sometimes I was affirmed in finding out that the legislator was like, thank you very much, and dismissed the story because it didn't have the backup data of this is not just my experience. This isn't just the experience of a few folks. Here's the experience of many. So thank you to those in our field who have been doing this work in data, VSA, AFB, and others. So taking that data and that research, moving it together with a compelling story, and then having a very tangible and an impactful request. One of the things I hear sometimes from policymakers, and I love to have legislators talk with our grassroots or on the ground advocates, is I ask them to tell what makes a visit impactful for you. And they name all three of these components. And then they hit hard on the don't leave my office without asking me for what you want. So often we tell a great story, we bring the data in, and then we say, thank you very much, and we leave. And the legislator or the policymaker is then left kind of holding the bag. Like, what do I do with all of that? And without a concrete ask or suggestion, then it's very easy for it to either drift off the radar with so many other things that are pulling on their attention, or they'll come up with a solution that doesn't really meet the need, but it's out of their best thinking. So have that concrete ask as well, and we can move forward. So a couple points here with the data and examples that I want to just tap into. They tie so beautifully to what others have said already. Here in Wisconsin, I have been so grateful for the population numbers that we've got. So in Wisconsin, 31% of our population does not drive. And that's across disability, it's across poverty, it's across rural, it's across urban areas, it's across race, it's across gender. 31%, and that is a data point that gets attention significantly more than when I used to say, yeah, a lot of us don't drive. There's just not a very effective argument. Very grateful for the VSA work on looking at adults with vision loss, how many in the various population groups, and the workforce participation. So I'm meeting again with our Department of Workforce Development tomorrow. When we did an initial presentation, another colleague and I, on the big data report related to workforce participation. Our Department of Workforce Development, where the Department of Voc Rehab is housed, went, wow, you've got our attention. And we'll be doing additional presentations and meetings with them. So very grateful for that. Looking at trends like education levels, like health conditions, like race, like gender, like education level and poverty. All of that, again, helps flesh out the story in really important ways, and then linking it together with other pieces of data. So I will often link the 31% of folks in the state who are non-drivers, and then make the correlation to the number of really concerning health conditions that those of us who are blind and low vision face on a regular basis, and then can make the distinction that sometimes part of the issue here is that we can't get to those appointments and we're not doing either proper wellness or preventative care. So linking those things together, and the predictive mapping and predictive math models are also so helpful. So I can very easily say Wisconsin is an aging state. So right now we have 31% of our population who do not drive and who often are dependent on caregivers, family members, friends, to get them from place to place. However, as those caregivers begin to age out and are no longer driving, then we will continue to see that population of non-drivers increase. And we'll also see folks who aren't able, who were a driver before, not being able to drive now. Just as an interesting side note, most women outlive their driving career by 10 years, and most men by 7. So aging adults need to get places. And then again, that power of combining data points together to really strengthen our story. And we can go forward. So some things to consider when we are telling a compelling story is when we can tell them in first person through lived experience or through, very close experience. That brings the heart to the matter. So the data brings the head, the story brings the heart. I have a new board member who's the mom of a 20-something young woman with an inherited retinal disease. And that mom tells a story that opens the heart, that is so powerful through her mom perspective and helping to bring forward the voice of her daughter. Focus on your main points in your story. Sometimes when we're telling a story through lived experience, especially if it's a painful story, we'll want to convey every little nut and bolt in it, and we lose folks. So really, what are the points that just are going to create understanding, help that person step forward into your experience just a little bit, but not lose them in getting caught up in all the details. Be sure that the story illustrates your data points. Make sure that you are creating a connected flow. And then connect your story to the ask or the solution that you're offering, so that really you've helped create a pathway from here's the big picture, here's why this matters to me, here's what I'd like you to do about it. And then when possible, connect your story to the person you're talking with. So a number of years ago, I was speaking with a legislator at one of our advocacy days in the state capitol. And as he was telling a little bit about his story, which I think is always valuable, I learned that he was a dad whose son was going to be going away to college for the first time. And so, I made mental note of that. I was like, ding, 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 this is really useful. I can connect with him on a parent to parent level. So I talked with him about having daughters who were at colleges within state, and that if I wanted to go visit them as a non-driver, there was one daughter I would not be able to visit at all. I would be dependent on someone giving me a ride. And there was another daughter, if I wanted to visit her, I was going to spend about 15 hours on a bus going across 2 or 3 states to get back into the state again to see the other daughter, who was about 5.5 hours away by car. And because we had that parental connection, he really got it. He was like, wow, that is painful. to think about not being able to see your kid or having to travel that far. So finding those authentic moments to find shared story. And we can go forward. So then thinking about our requests, we really want to be sure that they're concrete and specific as possible so that folks know what they really mean. You know, I'll often say, you know, we're asking for an increase in this particular transportation program here in Wisconsin. It's specialized transportation for older adults and people with disabilities. We're asking for this percentage of increase that translates to this much money. That's this portion of the state budget, which is a tiny little finger of the state budget, and really painting that picture for them. So they've got a very concrete understanding of what we're asking for. Connect how your request can lead to positive change and how that positive change benefits more than just our population. So really tapping into the curb cut effect that was discussed earlier. Be visionary, be innovative, yet be practical. You know, don't ask for things that are absolutely impossible because you'll get dismissed because it just feels too, we can't even wrap our arms around what you're asking. Avoid being negative, you know, ask for what you want rather than what you don't want. It's much more life affirming for people to be working towards something than working against it. Learn from the feedback that you're getting. There's been times I've asked for something and a policymaker says, I hear you. Here's the issue with that. This is what what's prohibited in state law. And then once I've got that information, then we can open up a conversation to say, okay, how can we work around that? Or how do we make the legislative change, the statutory change that needs to happen here? Avoid negotiating against yourself. This sounds silly, but it's so incredibly easy to do. One of the things we're working at here in Wisconsin is getting an accessible absentee ballot. And I know that that's a very complex thing. I know the state law. So, you know, sometimes in my mind, I never say it aloud to a legislator, thankfully, but I can think about a pathway and steps along that pathway. And maybe if we take step A, then we can later on work towards step C or B or 2. Sorry, I'm confusing my alphabet and my numbers. But I want to name the thing that we really want. You know, we want an accessible absentee ballot that can be that we can get in an accessible format and return in an accessible format. So ask for that. Don't short sight yourself. And let's see, I think we can go forward. So the work is huge, you know, for the things that we are striving for, you know, greater equity, essentially. And so kind of trying to do that alone is a lot. So building coalitions is incredibly helpful for this work. When it's bigger than us, who can be our collaborators, who can be our partners, who do we have enough in common with that working towards the greater good with each other actually amplifies our voice? I know that in my advocacy around voting rights for people with disabilities, transportation access, access for vision rehab services, when I'm doing that with people, we have a bigger footprint. But I also have folks that I can brainstorm with, problem solve with, commiserate with. It keeps my energy going for doing the work. So a coalition is really a group, sometimes informally formed, sometimes it has a formal structure around it that brings people together, resources, material, financial, talent, to achieve a common goal. And we can go forward. So some benefits of coalitions, I think I've touched on these already, so I'm not going to spend a lot of time here, but the benefits really are increasing that footprint and increasing the possibility of diverse perspectives and diverse solutions. Sometimes folks worry about being in a coalition, like are our interests going to get usurped? And we need a big voice in a coalition. We also need big ears so that we can find solutions together and we can go forward. Some of the coalitions that I am so honored to work with, I'm on several that are government organizations. I'm the co-chair of the Wisconsin Non-Driver Advisory Committee, which is owned by our Department of Transportation, and has folks from state agencies, legislators, local political leaders, other organizations who do advocacy work, poverty organizations, homeless and unhoused folks that are supporting folks who are unhoused. On it goes. It's a very diverse group, so that we are addressing a multiple perspective of needs. Nonprofit or coalitions. I'm on several there as well, and we sit on ones like the Wisconsin Disability Vote Coalition. We have Coalition for Responsible Transportation, More Responsible Transportation. We have a coalition for social connection to really reduce isolation and loneliness. Sometimes these coalitions can be short-term. I've invited together our transportation buddies that really focus on disability and older adults, so that we just spend some time getting on the same page with our transportation asks during the state budget and our strategy for managing that. And then some are much longer terms. The Wisconsin Non-Driver Advisory Committee is about to celebrate our 6th year of being together. Disability Vote Coalition, a number of years as well. So I think this might be my last slide. We can go forward one. Yeah, there's just some ways to connect with us. We would love for you to reach out. We're on Facebook, we're on Instagram, on LinkedIn, and also our website is at wcblind.org. So I'd love for you to connect up. Look at our advocacy page, look at our media page, see what is there that might be helpful to you. So again, thank you so much, AFB folks, for inviting me to be here. It was really an honor.
All right, thank you so much. I know we're running a little behind. I wanted to be sure to thank all of the presenters. So Sarah Elizabeth, Sarah, Denise, and of course Stephanie for kicking us off. And I also want to thank our ASL interpreters, Andrea and Beth, who have been interpreting this entire webinar into ASL, and the ASL will be available on the video recording as well. And I want to thank May Vader, who's one of our research team staff members who has been helping advance the slides. We are at time, unless there's a way to extend the webinar for people who have questions. We may just need to adjourn at 1 o'clock. We appreciate all the questions that have come in so far, and we've done our best to answer them. You can always contact us at research@afb.org. If you want to ask questions, we're very interested to learn how you might be using some of the research resources that we've talked about. So please absolutely engage with us. Tell us what you've been doing. Ask us questions. We're available for certain kinds of research collaborations as well, mutual grant writing opportunities, things like that. So definitely reach out. We do also request your help because this is the beginning of a series of webinars, and we want to know a little bit about how we did and how we can improve in the future, and what you might have gained from being at this webinar. So it was just put in the chat. Please go to this link to fill out our short evaluation survey. It's tinyurl.com, so tinyurl.com/2025 advocacy webinar survey. You will get an email in a couple of days, just kind of following up with the recording link. So if you want to go back and review the webinar, you can go to the recording link. You already received a link to the slides, and then you will also get a link to the evaluation survey if you were not able to fill it out today. Thanks, everyone.